And we'll get started here again. Thank you, Lynn, for the introduction. My name is James Ridley. I'm a pharmacist by trade, and I am the Director of Clinical Affairs here at the PAN Foundation. I'm so happy and excited to share all that we offer and our resources throughout this webinar today. And I'll turn it over to Brittany for her introduction.
Yeah, so I'm really excited to share about our patient assistance funds with everyone here and some other available resources for education and advocacy. You've already said it, Lynn, but if you all have any questions or something comes to mind, please feel free. I'll try to monitor the chat or just come off mute and ask your question. We'll be really informal here. And so if you have anything or any burning concerns, just let us know. We're always excited to share about the mission of PAN.
All right, so let's get started. So just understanding the challenges that patients face accessing the care they need. So here at the PAN Foundation, we do a lot of not just as far as financial assistance, but we also do research because we understand that you need supportive data in order to support your mission and to be able to tell your story. And we know that there are several challenges around awareness, about resources that are available for treatment costs. And through that, we have seen that there has been abandonment from pharmacy counters because patients are not able to pay for their medications, also a reduction in medication adherence, and likely, as a result, that leads to poor health outcomes. And in addressing this need are extremely critical and important, and that is where we stand in the gap to help fill those needs. So, again, I mentioned that we do research. So this is our second, we do have a state of patient access research and survey that we send out. And we have the results from 2025. So we sent out more than 2,700 adult patients with chronic health conditions who answer questions in 5 key categories. And through this survey, these are patients who have been diagnosed by the healthcare professional with at least one chronic healthcare condition, and more than half had multiple chronic healthcare conditions, and nearly 1 in 10 have 5 or more conditions. And through this study and research, we found that the overall score for access to healthcare came in at a grade of a C. And if any of you all were very had parents like mine, C's were not good grades, and especially when we're talking about the state of healthcare in the United States, C is not good. And from the results, the overall grade of accessing care was a C, but it was broken down in subgroups. So relationships with healthcare professionals, also affordability of prescription medications, access to treatment through the healthcare plans, and then also financial toxicity. So just a little, I just want to provide a little bit of resources in regards to the financial assistance landscape. So there is a huge need to improve healthcare access. Of course, through the studies that we have conducted, also through going through listening sessions and hearing the stories of patients talk about the struggles that they have accessing their healthcare. And we look at that 48% of U.S. adults with a chronic health condition said that they have faced logistical barriers to care, trouble getting to appointments. I myself have heard countless times that transportation is a huge barrier to accessing health care. Also, financial difficulties, not being able to pay for medications. I say for myself, when I used to practice pharmacy, I have seen thousands of times where, well, maybe not thousands, but hundreds of times where patients will come to the counter, they get the price of their medications, and they have to make decisions like, am I able to pay for this medication, or do I use this money to pay for my bills? And I know that we should not have to choose health. That should always be a priority, and it should not be a financial barrier. Then also, at 50% of U.S. adults said that they are unable to pay a $500 unexpected bill. Medical expenses are very, very expensive, and especially when we think about patients who are at a Medicare age and they are on fixed incomes, retired, there's no room for unexpected bills. So financial resources for prescription medications is for your awareness, and we will share all of this. Is a lot of information, but there are several different resources that are available. There are pharmaceutical manufacturer assistant programs. These type of programs are basically when you see them on TV, when there's a pharmaceutical company that has a drug, they will offer a copay discount card for that particular drug. Unfortunately, due to some federal rules, people who have federally funded insurances cannot use those copay cards. So if a patient has Medicare, they cannot use those cards. So that is where we fill in the gap, but I'll talk more about our organization. There's extra help for Medicare patients. That is a program. Also charitable patient assistance foundations, like the PAN Foundation. We are a charitable assistant foundation, and also we are able to help patients with federally funded insurances. There are resources such as FundFinder, and we'll talk about that later. That is a resource that we actually offer here at PAN Foundation as well. There are state pharmaceutical assistant programs. These are state run and they differ from different states, but they are available. Also Medicare savings programs. There's an AIDS drug assistance program as well. So I'm going to give you a little bit of information about PAN and the critical role of charitable foundations. So here at PAN, our mission is to accelerate access to affordable, equitable healthcare through our three pillars: financial assistance, advocacy, and education. So we are driven by the belief that everyone deserves access to affordable healthcare and equitable healthcare. Since we were founded in 2004, we have helped over 1.3 million patients, underinsured patients, to receive financial assistance from us directly. We have given over 4.5 billion in financial assistance to patients. And currently we have more than 80 plus disease funds where we offer, and we'll get more into the details of that, but we offer a wide variety and range of diseases and coverage. So I work through financial assistance. Our disease funds, we offer financial assistance to help cover medication costs. We also help with insurance premiums. And if and when a patient is enrolled in either one of our copay funds or premium funds, they can then apply for our transportation assistance. And the beauty is that a patient can actually be enrolled in all three of them if it is available. Also advocacy work. We understand that we have to stand and champion for policies. We have a mission, but we also have to go forth and champion these policies so that there are lower out-of-pocket costs. And then also in education and awareness, our education initiatives provide clear information about the complexities of this healthcare system. Also education around the disease funds that we offer, around resources. And then also we pride ourselves on being a place that you can come and receive Medicare reforms information, different forms of resources, and all of them are available on our website. So we have a national reach. So through the PAN Foundation, our financial assistance programs ensures patients across all 50 states and U.S. territories can receive access to our resources. We serve patients all throughout the U.S. and again in the U.S. territories. And our impact. So again, just to recap, we've given directly over 4.5 billion to patients. We've helped over 1.3 million to date. 93% of patients who report that PAN has supported them have had positive outcomes. We've done national polls. We have a marketing team that is always sending out updates and resources out. We offer webinars. And through all of these initiatives, we've just been able to have such a great impact. But it doesn't stop there. This is why we are here now. We're always here to educate, because we have seen that there are a lot of people who still do not know about these financial assistance programs and PAN Foundation. So from here, I will turn it over to Brittany, and she'll talk about some of our assistance that we currently offer.
Yeah, so as James mentioned, we offer three types of financial assistance at the PAN Foundation, and it spans a portfolio of diseases ranging from oncology funds to also chronic and a lot of rare diseases. So that's copay assistance, premium assistance, and transportation assistance. For our copay assistance, that's going to go towards your medication copays, deductibles, or coinsurance. We also offer some funds for healthcare premium assurance and assistance there. And then if you are receiving either of those grants, you're eligible also to receive a transportation assistance fund when our funding is available for that. I'll go into that in a little bit more detail, but it's great with assessing some of those issues and concerns around getting to appointments or just getting to other needs, grocery store, running to errands or traveling. Even if you had a plane ticket you couldn't afford it, you could even cover that. Here's a list of our covered diseases currently. So as James mentioned, we all have almost 90 covered diseases right now at the PAN Foundation. And I will point out in our oncology fund that we do have a small cell lung cancer and a non-small cell lung cancer fund. Those, as of today, those funds are currently closed, but we are, you have the availability to sign up for a wait list for those. So our wait list holds a place in line for you. And when funds become available, you can apply for those. We give you a ping, we send you a message via email and alert you that that fund is available. I'll also talk about our FundFinder, which is a great resource as well for additional funding. Any questions here about our covered diseases? Well, just know that we are working all the time to reopen funds and add new funds. So it's awesome to bookmark PAN Foundation and check back frequently because there might be more funds that are available to you than you see here in subsequent months. And
I got a question, Brittany. Mm-hmm. Sorry. This is Sandy, but what do you mean by fund? I don't understand the fund thing.
Yeah, so it's a charitable assistance fund. And so we call them our disease funds. And these are charitable assistance funds that cover the three types of different grants that we mentioned here. Most of them are copay funds, and then some of them also have a premium assistance fund. So in the list here, you'll see that those are denoted by an asterisk. So for those particular diseases, there is a premium fund also available.
And that's where the money would come from. So when you say it's closed, that you can't get financial assistance, is that what that means?
Right. If it's closed, that means you can't get financial assistance today. That doesn't mean it wouldn't be open as soon as even tomorrow. So it is worth, if those funds are listed as closed, signing up for that wait list. And then again, that holds your place in line. And you have a dedicated number. We'll let you know as soon as that fund becomes available. And it's first come, first served. So those wait lists are the ones that we open up those closed funds to first.
Hi, Brittany. Brittany, thank you, James, for coming out and sharing with us. Okay, is there an income eligibility?
That's a great question, Vicki. I'm actually about to cover that soon. So there is. It is very generous, and it's about 90% of the people who apply for assistance end up qualifying.
Right.
I have a quick question. Mm-hmm. Looking at that list under oncology, this is made of, I'm not seeing lung cancer.
So we have a non-small cell lung cancer, and we also
there it is. Mm-hmm. Okay.
And we also have small cell lung cancer.
Okay, and thank you.
And Brittany, real quick, just the level set so that we understand, like, I'm just going to give an example for our small cell lung cancer. So our funds are not drug-based. Our funds are disease-based. Mm-hmm. So for small cell lung cancer, the assistance amount, and Brittany will go a little bit more in depth about that, is $5,000 per year for the patient. And that could be used for the copays for those drugs that are FDA approved. And on each fund, we have a full formulary. So any drug, and my department oversees this, any drug that is FDA approved or guideline listed is included in that formulary. So, and we pride ourselves on doing research daily to make sure that any new to market medication that is FDA approved is included on our formulary. So a patient can be on multiple medications for that particular disease state, and we will pay for the out-of-pocket costs for all the medications that are indicated for that disease.
Okay. So, for example, Medicare may pay just say 30%, hypothetically. Now, the patient is short of the 70%. Now, is there some type of process that you go through with the patient to ensure that they receive their medication, or do the pharmacist bill you, or do you give this $5,000 and, like beginning of the year, because you already know the background medically of the patient, I'm sure, before you even engage in any type of assistance.
Correct.
So what's that process?
Correct. And it's going to be detailed out, but really quickly, to your point, as soon as a patient is approved, they have access to the funds. They receive a pharmacy card. So to your point, if let's just say Medicare pays the 30%, then PAN will come in and pay the 70%, and the patient will walk away from that pharmacy paying zero out of pocket for that.
Wonderful. Wonderful. Thank you.
All right, Brittany.
Questions. A little bit more about our transportation assistance program. So to date, we've served almost 9,000 people with this fund. As I mentioned, if you are receiving a PAN grant for our medication assistance or for those the premium assistance funds, then you would be eligible also for our transportation assistance funds. What's great about transportation assistance is this is paid out as a $500 gift prepaid card. And so you can use those on eligible expenses. And so if you need to fill up your car with gas, or if you need to get a Lyft or an Uber ride, or as I said earlier, even if you need to pay for a plane ticket to receive treatment, all of those types of expenses could fall under the umbrella of the appropriate use of those funds. All right, so a little bit more about how financial assistance works at PAN. So here is a list of general eligibility requirements. I will note that some of the requirements do vary by fund, but this is in general a good kind of tick mark to determine whether or not you might be, you or a loved one might be eligible for our patient assistance programs. So for the first one, you need to be getting treatment for the disease that's named in the assistance program. So for example, for our small cell lung cancer, you would want to have a diagnosis of small cell lung cancer and receiving treatment within the last 90 days up to you're going to begin receiving treatment in the next 120 days. You also need to reside and receive treatment in the United States or our U.S. territories, but U.S. citizenship is not required to receive PAN assistance. You also need to have specified health insurance. So that could be Medicare or it could be a commercial product, but there are limits and lists, they're all listed on each of our disease funds. I'll give you a 1877 number or it's a 1866 number. It's a 1866 number that you can call. And if you ever have any questions or concerns, they can help you walk through any process that we have. You have to have a specified health insurance, as I said, and then it has to cover the medication or product. You also have to be prescribed a medication or a product that's listed on our list of covered medications for that disease. As James said, though, every FDA-approved medication for the disease is on our formulary, and we're updating those constantly. And then finally, Vicki, to your question, you do have to have an income that falls at or below the indicated level of the federal poverty level. For our funds, it ranges from 400% of the federal poverty level up to 500% of the federal poverty level. And just to give you a guideline about what that looks like and what it would look like for your family, I have a list here goes from household and family size from 1 to 8. And you can see those levels and income limits from 400 to 500% going again all the way up to a family of 8. We have real-time income verification. And so you will get within 10 seconds of submitting an application, you will get a determination. And then, as James said, those funds are available immediately upon approval. If there are any questions, I did get this question last time. If you were unable to work, so you filed taxes and your income might have been more last year, but are unable to work now, especially to a disease diagnosis, we have a process by which you can let us know you have hardship and that your circumstances have changed. So no worries about that. As James mentioned, the assistance amounts vary per disease fund. It's about $4,800 to $5,000 for our lung cancer funds. And they're designed to cover the average out-of-pocket treatment cost per each covered disease. So we do a lot of research to set those limits. patients have a 12-month eligibility period. So from the day that you're approved, there's a 12-month period that you're covered for that grant fund. Patients and then we do have a 3-month look back. So we know sometimes people don't reach out for assistance at the time they were diagnosed. So we also do a 90-day look back. And if there are other funds or claims that you have for medications that you weren't able to afford in that time, we will help you with that assistance. So a note as well, once you receive an assistance fund, patients, their provider, or their pharmacy need to submit a claim at least once every 120 days. So we let you know at 90 days if you haven't done it in the last 3 months. But if we don't hear back from you on that 120th day, we will release funds back so that other patients can benefit. So again, that's just once every 4 months. So 3 times a year, you just want to make that claim. We get a lot of questions about the potential for renewal, and the answer is yes. So if you run out of those funds, so if you have very expensive medications and you run through that $5,000, there is an opportunity to apply for additional assistance within that 12-month period. And then once you're ready for renewal, at that 11th month, we'll prompt you that you are eligible to renew for a new year at that 11th month so you don't ever run out of funding. You don't have that gap. Any questions here? Okay, just a note on what we cover. So James talked about this a little bit, but we cover all prescription medications, including the generic or the bioequivalent drugs that are FDA approved for the disease or that are listed in the official compendia. We're always updating that. If new drugs are coming out, they're getting added immediately. But what we do not cover are going to be medical services, office visits, or lab work. If your product isn't covered by insurance, PAN also is not able to assist with that type of product. And then if your product is paid by the insurance payer at 100, then that's covered, and so we wouldn't be able to help there. Or products that are billed only to discount cards. And again, if you ever have any questions, we've got great patient support specialists that are available to assist you with any specific questions you have about your circumstance. So now you're like, okay, Brittany, how do I apply? So we have a 4-step process of applying. You're going to check and see if that fund is available. And as I mentioned, for those lung cancer funds right now, they are closed, but I will tell you how to sign up for that wait list. You'll verify your eligibility for the fund, gather some basic information, and then submit your application. It takes about 7 to 10 minutes on average for each person to apply. And again, you'll get instant approval notification on whether or not you've been approved, and you can start using those funds right away. So the easiest way to check if a fund is open is to visit our website or to use your PAN portal account. So PAN portal account is an online 24/7 portal, and you can manage your grant funding, and you can submit claims, and you can do all of the stuff in real time. You can always call us if you just like to talk to a real life person. I totally get that. I have that sometimes. I just called somebody today for a hotel reservation. You can call us at our 1-866 number, and that's open 9 a.m. to 5:30 p.m. Eastern Time, Monday through Friday. The next step is you're going to verify that you meet that eligibility requirement. So again, to get financial assistance, you want to be getting treatment for the disease that's listed in the fund, reside and receive treatment in the U.S., have health insurance that covers your product, be prescribed a medication or a product that's listed on our fund of covered medications, and have an income level that falls within the federal poverty limits for that fund. A really great tip to use is our homepage eligibility tool. So if you head on over to panfoundation.org, what's going to pop up on the main page and on every single disease fund page is going to be this really, really great, pop-up box here. And what you can do is search for your disease by medication, disease, or service. You'll select I'm a patient or a caregiver, or if we have any providers on the line, you select that, and it'll help you determine whether or not you are eligible or your patient is eligible for the fund. And then you can go right ahead and apply if you're eligible. It's a nice little shortcut. The next thing you're going to do is gather some required information. So it's just going to be basic demographic information like your name, date of birth, social security number. It's also going to be your diagnosis and your medication names, insurance information, so including that insurance ID number, your income information, and again, that's just your annual or monthly income and the number of people that live in your household, and then the information about your physician. So you'll just want their name and contact information and their phone number. and then set where you're going to apply. So after you've gathered all that information and determined your eligibility and made sure that fund was open, you'll apply. A note here, new patients, if you've never received PAN assistance, you will apply by phone that first time. As I told you, it's only 7 to 10 minutes. We've got some great people online to help you. For existing patients, you can go ahead and apply online through our PAN portal, or if you'd like to renew by phone, you can do that as well. And then if you have a healthcare provider or a pharmacy that's applying on your behalf, they can apply either through their PAN portal or by phone. And to get started with a PAN portal, you'll just head on over to panfoundation.org/PAN-portals. Or again, if you need to apply by phone, it's your first time, just call that 1-866 number. All right, like I said, instant determination is made on whether you're eligible. And if you are, those funds are available and you can start filing claims that same day. Any questions about that process?
Actually, there are a couple of questions in chat. Brittany, mine. Melissa was asking. Let me go ahead. She was the latest here. She wants to know: does it matter what kind of treatment you're getting?
Treatment as far as the medication treatment or infusion?
I'm asking in terms of like your medication. I realized over the years, if you need assistance for anything, they always say you have to be in treatment, which they would just say, meaning chemo or something. I take my treatment orally every day, but I'm still, fighting for my life too. But people seem to only want to, give that extra assistance to people that are, going to get chemotherapy. So I was just asking, does it matter what kind of treatment?
So if that treatment, whether it's chemotherapy or the oral medication, is indicated for that, so that I'm going to use, for example, here, if it's indicated for small cell lung cancer, then both medications will be on the formulary, so that the assistance will continue. And again, if you're on multiple treatments for a particular disease state, all of those medications that are approved for that, you will get copay assistance for each medication.
Okay. Or just, anything else that you offer too. Does so it doesn't matter? That's what I'm curious about.
As long as it's directly related to that particular. So let me use, for example, let's just say for our lung cancer fund, there's a formulary there and all the medications that are FDA approved or guideline listed. And let's just say, for example, you're on 4 of those. We cover all of those medications. But let's just say your 5th medication that a patient may be on is for hypertension. Hypertension does not fall under that disease fund, so we wouldn't pay for that hypertension medication, but we would pay for all of the medications that is listed for that particular disease state.
Dr. Ridley, along those lines, I'm going to go ahead and mute you, Melissa, just in case. Lisa, this kind of piggies back on it. So Lisa asked, is there potentially assistance for drugs like Eliquis, which helps with it's a blood thinner, which isn't specific to lung cancer, but it's prescribed because of her history of a pulmonary embolism. So things like that. I was also going to ask you, what if you have 2 disease states? So
good question. So a patient can be enrolled in multiple copay funds. So we have Eliquis on some of our formularies. Even I'm just using, for example, a patient can be enrolled in non-small cell lung cancer, and then also they may have been diagnosed or had a history of pulmonary hypertension, just for example. We have 2 funds for both of those. So they can enroll in both, and all the medications that are covered for each disease state, then we will then pay for both of them.
Wonderful. Thank you. Thank you. And then while we're on it, you guys, I'm sorry, I'm going to jump in with the other questions from chat. There's a question about the income requirements. Does that include any retirement funds that a patient withdraws? This patient is living off a disability payment supplement by RIA withdrawals. Would that be included in her qualifications for the?
I do know that usually that varies from patient to patient. Usually whatever is taxable income is the income level in which because we do a quick Experian pool, and not a credit. It's just a way to see what the taxable income is for that patient or household. So that would vary, but usually I'm thinking about for disabilities, most of the time that it's not taxable. So it could vary. So I don't have a direct answer because that's more patient specific.
Well, and it sounds like for the first time that a patient would apply, they're going to speak to a human anyway, right?
I was going to say, if you do have, we know that a lot of people's I guess their situation is very specific to them. And that's what's great about our patient support specialist is that they can help walk you through that. They've seen almost everything. And so they'll walk you and let you fill out any additional forms if you need to. So if your special situation requires some additional forms outside of the regular process, they can walk you through what that look like. And again, even some of the more complicated verifications, those are only going to take up to maybe 12 minutes. So you're not going to have to spend a long time with that.
Okay, wonderful. Thank you. And then one last question that is formulary related, and that is the only patient or the only medication Cindy is taking is not covered at 100%. It's a muscle relaxer. Mm-hmm. And so again, would she need to have a specific diagnosis for that, or how would that, how would she find out if that's going to be covered?
Yeah, because I see my drug is on that list because I take crizatinib or Xalkori, but I already have assistance to get that. Mm-hmm. So would I still be eligible for other things though, like transportation and stuff? Because the only thing that's not 100% covered for my meds so far is a muscle relaxer.
So the muscle relaxer would not be because it's not on. If it's not on the formulary, no, we would not be able to cover that particular medication.
But just because my medication is already funded does not mean that I could not ask for help with transportation if I needed to. Is that correct?
So in our current process, a patient has to be enrolled in order to receive the transportation to apply for our transportation fund. Okay, let me break it down so that you understand. So if you were to enroll in, let's just say, for example, in the fund, and we have a grant use policy, and that grant use policy, Brittany spoke to that, where if there's not any claims in 120 days, then that money is returned so other patients can use it. But once you are then approved for a fund, you have the opportunity to apply for transportation assistance. So
okay. So because my crizatinib is now paid for, there's no applying for anything then.
Correct.
Okay, got it.
So for those of you, a couple of things we've talked about aren't covered, but we don't want anyone to hit a dead end. And so if you don't qualify for a particular assistance from a fund at PAN, we want to make sure we're connecting you with other resources out there. And so that's how we created FundFinder. So our FundFinder is a web-based, I guess, an application really. And so what you can do is head on over to fundfinder.com. And it might be fundfinder.org. Also, I'll confirm that with you, and I'll update the slide when we change this just to make sure, but I don't want to send you to the wrong place. So FundFinder is it helps you to track patient assistance fund in one easy place. So we don't want you to have to run around. And again, once you've had potentially, the answer might be no for the PAN Foundation, but it might not be no for everywhere. And so this connects you with 200 patient assistance funds across 9 charitable organizations. Not only that, but we also have a network of partner organizations that will help you join support organizations or advocacy organizations. We just want to make sure that people that, particularly that are newly diagnosed, have a lot of support and resources around them and have those at your fingertips. You can sign up for email and text alerts when a disease assistance fund that you're interested in opens up, and that's both at PAN and outside of PAN. All right, so you just create that FundFinder account, find and follow the funds that are of interest to you, and then you get notifications instantly. It's just a great way if for folks here and also other people in your life that might be having chronic diseases, rare diseases, or cancers that they're dealing with. It's a great resource. So we have about a 50-50 split. So half of our users are patients and about half of our users are providers. So we'll be taking any final questions you have, but I wanted to leave this here for you. You can use that QR code to go ahead and sign up for email updates from PAN. And this is how you're going to learn about any new programs that we have. If you're interested in advocating for healthcare access, talking to your legislators and elected officials, we do a lot of work there, having opportunities to give patients a voice and to advocate for expanded access and tell their story. And you can get involved with our larger PAN community. We've also got a ton of educational resources available. So if you have questions about some of the new Medicare reforms that have come out lately, about the new drug caps or about the smoothing of costs over the year, these are great resources there. We've got clinical trials information. So if you've ever thought about being part of a clinical trial or interested if you're a good fit for a clinical trial, there's a wealth of resources for you and for your provider there. And so really the sky's the limit. We have a lot of information, and this is just a great way to stay connected and up to date on all of the good stuff we have going on. As James mentioned, we also do a ton of research. So we do research on patient access, and you'll get all of that information, all of those fund reports as soon as they are available. We are where you are on social media, generally speaking. So if you're on Facebook, you can find us there, or on Instagram. We also have a YouTube channel. And if you're on LinkedIn, we are there too. We have our contact information if you have any questions. If we didn't cover anything, please don't hesitate to reach out. We love talking with patients and providers. This is why we're here, is to make an impact and to help connect people to the resources that they need. So if you ever have any questions, please don't hesitate to reach out and give us a shout.